Who was the other?
Last one.
Okay, ladies and gentlemen, we have 45 minutes or so with which to cover as many questions as we can. These are in no particular order. We've got more questions than we're going to have time to answer. So this is the order in which I've been given them, and the lady who gave them me is somewhere in the room, just in case I get Mrs. Dixon having a go at me. I think you might be on the list, actually, Mrs. Dixon, which was a surprise to me as well. If the plan is, if I read out the name of the person, have you all got the questions you've asked?
Probably not.
Well, some have, some haven't. I was told that you would have, and you could read your own question out. If I can read the writing in certain cases, would it help if I actually read the question out to save time, yeah? Okay? And then we'll ask the candidates to give a very succinct answer. By succinct, I mean minute or less, please, and we get more questions asked. Now, we're using these microphones. I've been asked to relay to the candidates, please project. That might mean standing up. Can we manage standing up? Excellent. We're not too elderly to stand up. Excellent. Cornelius?
I'm younger than you, Jim.
Excellent. Cornelius believes he's younger than me, so we should be okay. Okay, the first question was from Jay Cross, and I think Graham Webster had a similar question, but let's go with Mrs. Ms. or Mrs. Cross.
Yeah, sorry, I didn't write like that, but it's about specialist students
That's
around
fine.
the country that we demand so much about from our NHS. I mean,
I actually have the question here. Do you want me to read it out? It'd be my pleasure. I'll read it out. Okay, this is from Mrs. J. Cross. She wishes to establish the candidate's view of more local general hospitals, but with specialist units dotted around the country, and that I take to mean, the units themselves. Thus, not expecting every hospital to cover all specialities, specialist equipment and staff. Is that correct? Good. So all candidates' view on the issue of the specialist units dotted around the country, in other words, sort of fairly equitably spread, I think. Okay? Who wants to start me off on that? First to stand up will be
the saving of costs, obviously, rather than expecting
don't make it too complicated. The first candidate to stand up will be the first candidate to answer. Rob, well done.
Thank you for your question. I was actually just talking about this a minute ago with somebody. Obviously I'm from Mebby and Kerner. We believe in decentralisation, and we believe as many services should be in Cornwall as possible. And I've always defied the way over the years that more and more services have been centralised, and that for very routine operations, people have to travel very far. I remember with the West Cornwall Hospital March, was it 13 years ago, that, we were losing the A&E then, and I always think it's a real shame that you have to travel all the way to Trellis just to do routine things like have a baby. But I realise it's quite complicated.
I've never tried it. Sorry, Rob. Sorry, Rob.
I think you must have lost half your audience.
I can tell you though, if your wife is due on Maisie Day, and that half of the A30's been roadworks and everything, it's not very routine. But when you don't drive, I didn't drive all the time, it was quite stressful. I was very worried about having the baby halfway up the A30. I do realise though that it is a complicated issue, and you can't have all of the specialist services in Cornwall, so I think it's something that needs to be looked at. But I'd certainly support another general hospital in Cornwall. I'd support the upgrading of West Cornwall Hospital and more services local to home.
Thank you. Yes, it's very desirable. I mean, what you need to do is to do something that is clinically safe, and I mean, there are separate issues between, if you like, providing the core services of a district general hospital, which you'd expect to see, if you like, serving a population of, well, in this case in Cornwall, at least sort of 300,000 people in the west of the duchy, and then those highly specialist services which we need to make sure are clinically safe, where the specialists need to, if you like, provide for localities. In some cases, when you're talking about neurosurgery and other subspecialties, where the catchment area, in order to be clinically safe, must be in excess of 5 million. And of course, getting that right and working with the Royal Colleges to make sure that those services are right and and properly planned is something which has already been fragmented as a result of the reforms, because you've got, on the one hand, you've got the clinical commissioning groups, in the case of Cornwall NHS Kernow, that's responsible for commissioning the bulk of the acute services here in Cornwall, but of course the specialist services themselves are largely commissioned from NHS England as part of a national pattern of services across the country as a whole, and that includes all of the teaching and training that actually goes with it. So I think it needs to be carefully planned. Some years ago we had an agreement from the Trust to merge West Cornwall and St Michael's Hospital, so that we actually had a route back to providing a more significant hospital in this area. Unfortunately, we couldn't get agreement across the community as a whole. I was a strong advocate for it at the time, but we need, I think, with the growing population, to look very carefully at a reconfiguration of acute services here in Cornwall.
Andrew, thank you. Cornelius?
Yeah, thank you. Well, I mean, I'm very much in favour of high quality care as near to home as can possibly be managed. But one of the dangers about the NHS moving to a market system, becoming a healthcare market, is that competing healthcare businesses will want to keep the business for themselves, rather than giving an honest assessment of whether they're the best organisation to provide the particular healthcare. So that's what I'm worried about, with GP surgeries going into minor surgery and that kind of thing. It's got to be about the person who's best equipped to do it. And in that case, nearness to where you live is only one of the considerations. And one of the great glories of the NHS for me is that I can go to the Royal Marsden if I need to. I can go to Guy's. I can go to the best hospitals in the country, some of the best hospitals in the world, and they are public hospitals. Now, many countries have good health systems, but above that public health care that is good quality, there's the top private hospitals who are another level of game, whereas in this country, the best hospitals are the NH hospitals. And if I really needed it, I'd go to Inverness if that was the best hospital, is when it comes down to it. But I'm very proud of that fact that some of the most famous hospitals in the world are NHS hospitals, even if they're not in Cornwall or Plymouth.
Yeah, well, in 2009, I spent 7 months of my life sleeping on whatever floor I could find in Bristol. And my son had an amazing bit of treatment. Every possible organ he had was going wrong. And I am completely in debt. I will never, however much I earn in my life, I'll never repay the cost of care that my son received. So I was glad to be in Bristol, however far from home, from my son, my other son and my wife, to be getting the best treatment for my son while he needed it. But I actually, a year ago, the Cornwall Council said they invited suggestions from people what we would like to see at the old Sinclair office site. Now I asked the question, that's all I did. I asked the question, could we use that site, it's a 10-acre site, could we use that site to relocate West Cornwall and to increase services, maybe diagnostic services and maybe treatment after care services. People travel a long way, sometimes from Plymouth, to get treatment after they've had a cancer operation. Unfortunately, there was 2 people right here that were very dismissive of that suggestion. I wasn't asking for today. West Cornwall was a fantastic hospital and lots of good things are happening. But as healthcare advances, as our need in healthcare changes, is West Cornwall going to be able to deliver? And if we lose sites like Sinclair to perfectly good things like housing, are there going to be suitable, adequate sites to meet the need in 10, 20, 30 years' time? So I asked the question, could Sinclair be a good site to relocate West Cornwall and actually provide much more services, including community care?
Derek, thank you. Tim?
Thank you. Yep, we always have this dilemma, don't we, in Cornwall and West Cornwall, about wanting to have services provided as locally as possible, but then not having the sort of population catchment to make some of those more specialist services viable. I think that I used to work in public transport and did a lot of work looking at patient transport. And the journeys that some patients have to travel to appointments is, it's a real challenge in transport terms, but also if you're a patient, you're frail and unwell, then you don't want to be travelling long distances. It's really important as well that if you're staying overnight or for several nights in hospital, that your friends and family can come and visit. That's an important part of recuperation, so we have to bear that in mind as well. But I do think that maybe we should be thinking about hospitals maybe not doing so much and more, and I do think it would be better to bring more of those services down to community and GP level where that's possible, including minor surgery, including some outpatient consultations, including things like dialysis. I don't see why that can't happen at a much more local level, and I think we need to be looking too at we talked about integration earlier, but we need to be thinking about integration between GP surgeries and hospitals, thinking about them being joined up and who is best able to provide the service that's required by the patients.
Tim, thank you. Okay.
Well, I like the idea of GPs doing minor surgery. I used to be all in favour of local hospitals for everything, but my partner, who's been a midwife and is now a nurse, and her ex, who's a consultant, he's her ex, but we're still on good terms, have convinced me that really centres of excellence are what is needed, and even routine things can go wrong. So, although I don't like the idea in theory, I've come to the definite conclusion that we need to have hospitals with centres of excellence for even what appear to be routine matters, and that means less here, but minor surgery, jolly good. It's difficult in a catchment area because we're surrounded by sea for so much. We haven't got as much around us, but we've got to act with what we've got.
Graham, thank you. The next two questions both relate to nurse recruitment, so I'll paraphrase them if I may. This is Mrs. Dixon and Jennifer Palin, who is in the building somewhere. There are two questions really. One is around what progress has been made in terms of recruiting more nurses for each ward. And the second question is around the fact that the NHS state they're 15,000 nurses short and have spent £831 million a year, or in a year, on agency staff and so forth. This is according to Radio 4, so it's not verified as such, but that's what was said on Radio 4. How would candidates change the situation? So generally speaking, what progress, if you know of progress, has been made, and how, if elected, would you seek to improve the situation in terms of nurse recruitment?
Do you want me to?
I'm looking for the first to win the race.
Sorry.
Mr.
Well, thank you very much. Well, I've been working with the Royal College of Nursing and the Florence Nightingale Foundation, the Nursing Standard, on the campaign for safe staffing and safe staffing levels on acute hospital wards, and what we are, as a campaign, calling for is the establishment of that safe standard, which is never more than 7. That is never more than 7 acutely ill patients on a ward to one registered nurse, excluding, of course, the nurse in charge. In many hospital wards, and there's been a lot of academic studies on this, and including international examples, to show that if you fall below that level, as we do across much of Cornwall at the moment and across much of the country, is that you put at risk patient care, and you do end up, as a result of that, with excess deaths on the ward. So we do need to address the fundamental standards on our hospital wards. Basically, over time, the acuity of patients on our hospital wards has significantly increased. The turnover of patients has also significantly increased, and I think a lot of people perhaps look at those people who are working on hospital wards, because they're often uniformed, won't necessarily distinguish, if you like, a fully trained registered nurse from someone who's had, in some cases, minimal training, but does an excellent and very valuable job as a healthcare assistant on that ward. So that, in my view, is very, very important. In terms of wider issues, I mean, there is an issue. I mean, in fact, Derek covered it earlier. He said there's one of morale. I mean, it doesn't help for the Tories to simply not allow our nurses to have the measly 1% pay increase which they should have been awarded by the independent pay review body. And I think that if you're going to deal with issues of morale, you need to first of all pay our nurses properly in order to get the recruitment up. And it is a false economy not to have enough nurses on wards, because patients get iller, they become more complex to treat, they come back into that hospital if they're discharged too early because they haven't been given the proper care. And also it's a false economy if you don't treat them decently. And right now, you know, nurses are being charged 5 times their hospital parking charges. They're being asked to do far too much on wards, too much stress and pressure, and that is reflected in indeed the reports which are coming out of the Royal Cornwall Hospitals Trust and indeed across the country in terms of the stress levels within that work.
Thank you. Yes, I was going to mention morale as well, because I think the question of recruitment, the other side of the coin, is retention. It's about retaining the staff who've come into the service. They've been we as a country have trained them. They've been recruited, and then they get disillusioned. The morale can be low. I mean, essentially, what's happened is because of there's been a big, ever increasing demands on our health service. And the numbers of staff haven't expanded to cope with that. So there's a lot more pressure, a lot more stress on staff who are in the system. And I think to a certain extent, the system has been relying on the goodwill of nurses and doctors and others in the service. And it's a form of exploitation, actually, when you're dependent on their goodwill in order to continue providing a good service. I think it's really sad how many health service staff have left the service. Actually, they've stayed in nursing or general practice, but have gone to other countries where generally conditions are better, wages possibly too. So many have gone to Australia and New Zealand. As a result, we're then using agencies to kind of poach health workers from East European countries and other parts of the world, where those countries desperately need a good health service as well. So the whole system is skewed and all gone slightly crazy. We do need to redress that balance, properly reward people, and make sure that their living conditions are attractive and make them feel that they are valued and want to continue working.
Tim, thank you.
Well, it's quite scandalous that there's such a shortage of nurses and doctors, and because it takes time to train them, and one can see it's coming, and nothing seems to have been done about it. If there's a shortage of 15,000 nurses, well, I was nearly going to say we have a plan, but that I'd have to wash my mouth out, because Mr. Cameron's always saying he has a plan. The manifesto says that there's going to be another 20,000 nurses, 3,000 midwives, and 8,000 GPs. As I said, that's been costed independently and stacks up, and that's what we want to do. The number of nurses in a ward ought to be a matter of a professional body saying this is how many we need, and then it should be accomplished. That's what happens in private nursing homes, so why should it be different in a public hospital? I don't understand it. Locums are costing us the earth, and the whole reforms, if that's the right word, of Mr. Lansley, the coalition have landed us with, are making people leave, and it's a revolving door. They then go to another health department, particularly administrators who seem to increase by 48%, and get jobs but have still got vast payoffs. We've got to stop this locums having to be paid and train the nurses. We want, sorry to mention tuition fees, Andrew, but we want to stop them for medical, and certainly, hopefully, that will get more people in. Let's do away with the tuition fees for them completely.
Yes.
Okay. Well, in one sense, there's a very simple explanation for the shortage of nurses, and that's the fact that the current government cut nurse training places by a quarter. So 5 years later, it's hardly surprising that there's a chronic shortage of nurses. It's not the only reason. I mean, the morale and retention issues that have been touched upon are also there. But cutting nurse training places were cut by, I believe, a quarter. It was part of the strategy to eliminate the deficit. which actually hasn't happened because not enough people are paying enough tax because their earnings are too low, and because the people who do earn enough to pay tax don't want to pay it and are allowed to dodge it. So coming back to the actual nurse training thing, it is, I think when you have a financial target for the NHS, as the Labour Party does, in terms of funding staff through a mansion tax and through a levy on tobacco companies, that's very, very clear. There's a target for tens of thousands of GPs, midwives, nurses, specialist carers. This is how it will be paid for. And I do think we have to have a specific pledge like that rather than just a general statement they're going to put more funding in. On the point that's made about targets for care, you know, whether we're talking about the number of patients a nurse should be caring for as a maximum, or even whether we're talking about targets for GP waiting times, GP appointments, I worry a bit about targets because they do have a distorting effect on medical priorities, and I think there is a problem, whether it's Andrew's target or actually the Labour Party's target about GP appointments, that you might be creating another problem because the target becomes the priority, not the medical necessity.
Thank you.
Yeah.
Derek?
Okay. Well, you'll be pleased to know there are 9,500 more doctors than there were in 2010, 7,000 more nurses than there were in 2010, 2,500 more midwives. And when I stood before 2010, we were screaming about the lack of midwives, and we don't hear that anywhere near as much, although I'm not denying for a minute that we need to do more. And you'll be really pleased to know there are 6,800 less managers in the NHS, so that's a lovely thing. But I recognise that there is a challenge, but I think we all share some responsibility, I think, in terms of making the NHS an attractive place to go and work, because it is beaten about and kicked about by politicians the whole time, both this end of the world and all around the country. If you're coming through school and looking for a career, the problem is what you read about the stress within the NHS and what you read about the problems within the NHS and what you read about the future of the NHS. It's little wonder that actually some people are not choosing that as a career path, they're looking elsewhere. So we have to change the tone if we want to really allow people to see what a privilege it is and what an opportunity it is to work within the NHS. Something changed under Labour in terms of recruitment of nurses. The standards you had to have, or you're going through you had to get a degree to as part of your nursing training. Now, I don't want poorly qualified nurses, but there are some. I never went and did a degree. I'm not a numpty. I have been able to do other things in my life. There are lots of people that actually going off and doing a degree might just not see their vocation or their skills and potential, but they would make brilliant nurses in the right kind of hospitals. And I wonder whether we need to look at how we broaden make it more attractive, broaden the opportunities for people to come into nursing and into the medical profession without having kind of arbitrary fixed platform of you must have a degree, because I've got a degree and I wouldn't be able to go into the medical profession if I wanted to at that level. So, although I'm actually trying to do something else. But I think the important thing will be to change the tone.
Derek, thank you. Rob?
I think nurses are vitally important, and as we all probably know, they're the backbone of the NHS. They're the people that do the most for patients on the wards. And I think the symptoms of low morale in nursing and the lack of people that want to go into nursing show us that there's real problems with the NHS. And one of the real problems we've had for this government, the last government, and perhaps in the future, hopefully not, is that healthcare costs a lot of money. If you want first-class healthcare, you need to pay for it. And we need a real political change. You know, everyone says, oh, the NHS is too much, and the Tories are not very keen on actually putting more money into the NHS. But we don't pay any more than they do in France or Germany for healthcare. So I think, you know, and to pick up on one of Tim's points, you know, nurses do need to be better rewarded. It needs to not be a long-hour, stressful job. It needs to be a very well-paid job and a very well-paid career. And I think really what we need from politicians and from the next government is real investment in the NHS.
Rob, thank you, and particular thanks for sticking to a minute, which I'm now going to impose on candidates. So, if you could wave at the back when a minute is elapsed, would that help? Excellent. We do have some. Don't panic. You can count to 60. We do have quite a few questions to get through in not a huge amount of time. This one is from Mary Osborne, and it's quite a complex question, but it's around mental health facilities in Cornwall, and the mental health facilities are few and far between. People are held in police cells as there is no room available anywhere, even if they need sectioning. They're just left with no care plan whatsoever. Now, I guess the question from Mary is, do you accept that? Were you aware of that? And briefly, if elected, what would you seek to do about it? Now, I can confirm that there is a substantial issue in Cornwall in relation to adequate mental health placements, or sort of places. Who wants to start, Derek?
I think Nick Clegg has done a brilliant job on this, and I have no hesitation in crediting him for bringing this right to the top of the agenda, and I think he's absolutely right to do it. There are young people around here who are just not getting support in schools and go very quickly down a really horrendous situation where parents actually just can't get the help. And so I think it's one area where I just want to chuck whatever penny, whatever bit of money, whatever money we've got to just change how we approach this and to make it much more of a recognised issue. It's something that's got a bit of a stigma attached, or at least people feel it has, so they kind of hide away, particularly parents, and so it's not been addressed. And we had a bit of a problem in Redruth where a PFI arrangement developed a lovely building for health, mental health care, and then it went wrong, and so for a long time it was closed, even though the NHS was still paying for it. And so that's an example of how PFI is costing Cornwall's NHS when it's not delivering service, and people with mental health problems were having to go out of county, and families were that is just something that should never have happened. So yeah, good. Chuck whatever we can to get it right.
Thank you. Next, if anybody, Tim.
Yeah. Yes, in a minute. It is a really important issue, and it's a Cinderella service. It does need more resources. I think it's really important that access to mental health comes up to being as good as access to physical health services, and it's way there's a big gap at the moment. What I'd really like to ask in the rest of my minute is why? Why is there such a big increase in mental ill health in our society? And I think we've got to address the causes rather than just the casualties. So we need to look at the strains on family life. We need to look at the effects on children of often substandard childcare in their early years. We need to look at issues of inequality, materialism, advertising, and people's living conditions in terms of overcrowded housing, and low wages and rather crap jobs. And all those things contribute to people's mental ill health, and we've got to really tackle the causes.
Thank you, Tim. Cornelius.
Well, I think this is a very good question because it throws into relief the fact too often and too much, and I'm as guilty of this as anybody, the debate about health and the NHS is always about hospitals. And that's not actually where most healthcare happens. When we're comparing ourselves with other countries' health services, we talk about what happens in Trelisk or Great Ormond Street as opposed to a hospital in Chicago. And in fact, the big difference between us and the American healthcare system is that everybody's supposed to have access to a GP and free or cheap drugs. That's the biggest difference between us and the Americans. And I think with Tim's quite right to talk about underlying causes, and examining why there has been this growth. Is it just diagnosis? Are there many more stresses in modern life that cause people to fall in a way they didn't before? We need to look into that. But the first priority is actually dealing with the symptoms, because when people have a crisis, when there is a breakdown, when something goes completely wrong, you have to deal with the symptom first before the underlying causes.
Cornelius, thank you. I'm liking this new system. It makes my life a lot easier.
I'm sure that was only 30 seconds, surely.
Perfect. Graham.
Well, we need more staff in the mental health service. I'm still a duty solicitor, and it worries me seeing some people in the cells who really shouldn't be there. I remember once challenging whether someone was fit to be interviewed. Oh, our doctor's seen him, say the police. I'd like to see the doctor. And he comes and says, well, I'm just a GP. If this guy came into my surgery, I'd be very worried for him. I want him to be seen. But I know he's not bad enough to be sectioned, so So there's no point in calling out the team. It's all changing now. Everyone in the cells is seen by someone with mental health training, and I'm hoping that it's going to change and people will be diverted. But we need more staff in the mental health services.
Thank you. Okay, Rob?
Really, I'd like to echo what everyone else says. A good friend of mine doesn't live in this constituency, lives in Grandpound Road, and the young lady he was caring for, she had kind of an episode, and she was sectioned by the police, and she spent the night in Truro Police Station in the kitchen. Do you know, it's an absolute scandal. And then she's now in a facility in Kent, and they have to try and get up to see her, and she wants to see the people that she loves. And I think it's an absolute scandal. And it really has to end, and it really has to be taken more seriously, and as seriously as physical health problems. I think it's awful. Thank you.
Thank you.
As you've heard already, and thank you, Derek, that the Liberal Democrats have certainly put mental health very much at the core and the future of the NHS, and certainly we want parity between physical and mental health. There is a silent scandal going on, not only locally but nationally, in terms of the numbers of people not even getting into Tier 1, Tier 2, and as far as Tier 3 and 4 services which don't exist, and certainly the inpatient services for children and adolescent services. Being a member of the Health Select Committee, we had a large number of witnesses coming, including Dr. Myers from our foundation trust, giving some excellent evidence as to why we really need to give this issue a higher priority. Tim is absolutely right. We need to look at the causes. We need to look at actually treating people at the earliest possible stage. The problem is we don't have the facilities in place at present to ensure that that happens, and so the problems escalate, and we don't have the facilities to be able to cope with it. At the moment, what Dr. Myers was telling us, that they're commissioned for 2,000 referrals a year, and they end up with 4,000.
Thank you. For the Record Committee, can we impose this system from the start in 5 years?
You'll have forgotten.
Okay, yeah, I probably will have forgotten. Touche. That's going to cost you a pint. Right. This question is from a Mr. J. McKenna. I can assure you it's not me because it's full of facts. This is the original and very much older Mr. J. McKenna. Would you like to identify yourself? He has done already. Are you reading your own here? Do you think people will understand your accent?
I used to say the difference between Jim McKenna and Joe McKenna was Jim was tall, dark and handsome.
Time.
If you're gonna speak, Joe, turn to the audience, please. Stand up, please.
Yeah, sorry. I used to say that he was tall, dark and handsome, and I was tall, grey and handsome. I used to be able to say that. Right. We've heard earlier this evening about how Cornwall has been underfunded in recent years to the tune of £220 million. I presume you're all up to date about the latest announcement made by NHS England, who are now telling us that in 2014 they actually gave us too much money, and as a result of that our funding is now being reduced by a further £42 million. My question to the candidates is a very simple one. There appears to be no mention in any of your party manifestos regarding changing the way health funding is allocated, and if it's not in the manifesto, no matter what you say, it ain't going to happen. So why should we vote for you when your party is apparently perfectly happy with the present system, which means that they are perfectly happy for Cornwall to suffer continuous gross underfunding? Thank you.
Rob.
Thank you for the question. And you haven't read our manifesto. It's released today. It's on our website, maybeincono.org. You read it today? Because what we're calling for is a commission on the underfunding of Cornwall and a fair funding deal for Cornwall and compensation for all of the years of underfunding that we've had. It was uploaded today. Have you read it today?
Yes. Joe, thank you.
It was uploaded today.
Injury time.
And yeah, we want to address the question of underfunding. Every party said that they don't agree with underfunding, but we really need to take that message to Westminster, and it really must change. Thank you.
Thank you. Tim?
Yeah, thank you. There are particular circumstances in Cornwall, I think, which is the sort of case for why there should be more funding for us. And it's based on levels of deprivation, population sparsity, geographical remoteness. There is another one as well, the impact of the tourism industry, right? But all those factors also apply to other areas. I think it's really important that we have a fair way of funding the NHS across the country rather than looking at Cornwall as a special case. I also think that it's not about fighting over a cake that stays the same size or possibly even shrinks. It's about getting a bigger cake so that we can provide decent healthcare right across the country.
Thank you.
Yeah, yeah, I will be brief. I mean, I am aware of this situation, not least because Graham Webster's explained it to me on many occasions. It is grossly unfair. That doesn't mean it won't change. Just because something isn't in a party's manifesto doesn't mean it won't happen, as the Health and Social Care Act has proved, I think, fairly conclusively. But I think, as Tim seems to be hinting, I don't want to get into a situation where things are all right nationally, it's just we've been treated badly down here. There is a national NHS crisis. We may have a more acute form of it because of the unfair funding formula, and that does need to change. And without wishing to sound too much like I'm sniping, you would have thought the last 5 years, when all the MPs in Cornwall have been government MPs, that would have been the time for the formula to change. But it hasn't. But yes, you're quite right. It needs to be examined in the context, as Tim says, of a national picture.
Yes, thank you. Okay.
Yeah, so yes, it's an extremely complex situation. Actually, the people who ultimately decide who it is actually not politicians. They're the Advisory Committee on Resource Allocation. And the allocation itself comes in a complex way. What Joe is referring to is, in fact, the allocation to the CCG in Cornwall. There, in fact, are other allocations which come to Cornwall which make the whole picture actually much more murky. What I think we need to do is to come together and to actually look at this issue. Again, you're right, Joe, that some of us have been campaigning. Actually, when we were in opposition, we managed to change this largely because we dealt with it on entirely the academic basis, arguing against the then formula, which had within that then formula that in fact wage levels were in fact one of the most significant determining factors, the market forces factor as it was known at the time, and we found that we were being £56 million we were getting £56 million per annum less than in fact we were due. Now that's changed again. We need to engage with this issue in order to address it effectively.
Okay. Derek?
Tim talked about as the cake gets bigger, then that's the very time to be fighting for a bigger slice of it. We clearly haven't won the argument yet, and the politicians we've had have not won that argument. And it needs to be corrected, I accept that completely. And no one is going to dare to be elected in this constituency or even in Cornwall and ignore this issue. It is all the funding for Cornwall has got to be, and other rural areas that have a similar situation, have got to fight the case and win the argument.
Thank you. Graham?
Well, it's a question of funding, and we've got to make more of a fuss about things. Our candidate in the Truro and Falmouth tells me that the same operation done somewhere else in the country will get funding vastly more than we get here for some reason. That's got to be changed. It shouldn't be in that way. We want to have local elected boards making some of these negotiations, and we want to stop some of the abuses there are. Even the Tory Crime Commissioner, for example, can't persuade his own government that our funding in Cornwall ought to be increased, because it's not how many live here during the whole year, it's increased for holidaymakers. Our national health is the same. More and more people come, and we must do that. And we must make it a national health system, not an international one. Stop some people coming from abroad, but to do that, you've got to leave the EU. We want a referendum. You can't do it while we stay in. Anyone who tells you otherwise is pretending and misleading you.
It's a very tenuous link.
It's all the fault of you.
Thank you, but nonetheless, Cornelius, it was within a minute, it was the candidate's view, therefore it's legitimate in the context of this discussion.
Was it tenuous?
I know. Okay, question now on home care. It's a fairly specific question, but I'll give the candidates the opportunity within a minute to broaden it if they wish. The question, which is not signed, but the question is, home care agencies are not under an obligation to provide a service. Many of us have experience of trying to find care for a relative. So how is integrating health and social care going to ensure that services are actually sufficient and available? Question mark. Okay. So the benefits of integration in terms of ensuring adequate home care services. The first to stand up will be the first to speak.
I mean, I'll attempt just to help my colleagues really here. I mean, the fact is that the integration in itself won't address the issue of those people who need care but can't currently find it. It's all to do with the fact that, and as you will understand probably far better than the rest of us on this panel, Jim, that if we're not able to pay the agencies sufficient on a unit basis for what they provide, that's going to be the clear determinant as to whether we're able to provide services across the country. I remember asking one of the health ministers how long it take them to get up that morning to get dressed, fed, watered, dressed, and so out to the door. And he said, well, it'd take about an hour. Well, often home care workers have to do that for a disabled person in less than 45 minutes. We need to make sure that actually we look at this whole sector and we pay people properly at a decent unit rate for providing care, which the vast majority of us are not prepared, I think, to do ourselves.
Thank you. Cornelius?
Well, I do think it's fair to point out that the solutions that are being put forward, particularly by the Labour Party, of integration of health and social care, will not of themselves solve things. So if that legislation becomes fact sometime in the next year, that doesn't mean that the year after everything will be all right. It won't be, because there's going to have to be a lot of building up and investment. But I think once the integration takes place, the whole mentality of how social care is going to be different, because it's going to be an NHS mentality, not a care market, a care sector market mentality. And I'm a Cornwall councillor. I respect the officers and staff of Cornwall Council and even some of the councillors. But there is most of the councillors, obviously. But I think it's fair to say that when you're talking about local government services, there's a kind of optional feel about them. We'd like to do it, but we may not. We should be able to do it, but we can't at the moment. Whereas when you're dealing with a national health, it has to happen.
Thank you, Cornelius. Tim?
Yeah, no, I agree with Cornelius on that. And I think that it's happened over a period of several years, really, that the eligibility criteria for support has been tightened and tightened. And we've got to find a way of kind of turning the clock back on that, really, because actually we need to be thinking about intervening earlier and intervening more effectively. And we also need to be helping people to sort of self-manage their conditions where that's possible. I think a lot of patients at the moment feel that they're not getting that advice, and there's statistics that I've seen that back that up. So but that doesn't solve the problem. Integration isn't going to solve the problem at the moment, because in a sense it's not part of the system in the first place to be integrated.
Thank you.
It's a brilliant question, because if we get this right, we reduce the demand and the stress on our hospitals and the results on the issues that we've seen over recent months and years. But I think we do need to have, I hate to say the word reform, because I appreciate that people detest it so much, but we do need to look at what should every person, every older person or whoever needs a care, what is the acceptable standard of care that they deserve, required to feel safe and valued, how to live as full a life as possible. We need to actually have that discussion and agree it. And then we need to look at reform what we do now in terms of providing social care, so that everyone can access it. And that is a massive, massive task. It's going to take more than money. It's going to take a lot of joint working and clear thinking and brave leadership. But it is the only way, if we really going to be satisfied that we are properly caring for the most vulnerable people, it's the only choice we have.
Thank you. Graham?
Well, I suppose the answer is I don't know if genuinely that you can't get people to do something and you can't be made to do it. I don't know what the answer is otherwise, and perhaps one should stop being ideological, and I never thought I'd say it, but think about privatisation doing it, if genuinely it can't be done. But I rather think the answer is instead to vote for a party that's going to put more money in and has the ability to do that, rather than be taken in, as the other parties seem to me to want to do, to make you vote for them without knowing where cuts to social services are going to come. I don't think you should vote unless you know what those cuts are going to be, because we'd be told them if they thought we'd like them.
Thank you. Rob.
It is indeed a tricky question. One of the problems you have with the current kind of care home system is that it's not a statutory service. They can cherry pick whatever they want to do, like with all things privatisation. I'd suggest what needs to happen is if we do integrate the two things together, health and social care, that obviously it would be my view that it would all be nationalised, but in the kind of short term, I think you'd have to place statutory obligations on care home providers to do things like pay people fairly, but also to provide certain services and certain levels of care. If that's going to be a state service and that's going to be funded by the state, I think the state would need to take a lot more control of those services that they provide.
Okay. Thank you. I now have a number of what are best described as targeted individual and possibly political questions from members of the audience. Cornelius, you can relax. Rob, you can relax. Tim, oddly so can you. Andrew, you have 2 to answer should you so wish. Graham, you have 1. And Derek, you have 1, I believe. I may have miscounted. Are we comfortable with answering them? You can always say no comment.
I'm quite disappointed, actually.
Well, yes, Cornelius, because I know you like to speak along. But give other people a chance. The first question is for Andrew. It's not actually signed, but it's a written question. Given, and I thought it said mental, but it says marked differences between the Liberal Democrats and Conservatives on health, can Andrew George confirm he would oppose a coalition? And I presume that means between Lib Dems and Conservatives as we have at the moment. Within a minute.
It's not going to happen. I mean, I wouldn't back such a thing. We've had enough of it. The Tories wouldn't want it, would you, Derek? And I'm sure that my party wouldn't go for it. I mean, when we went into this before, there was no question that in entering such a coalition in 2010, it was going to toxify the Liberal Democrats. I mean, if a nice party forms some kind of arrangement with a nasty party, I mean, you do tend to get toxified as a result of it. But we felt that we were doing it for the good of the country rather than the good of the party. We knew that it was going to result in some damage to our party as a result of doing such a thing. I argued that we were going in too deeply, too quickly, and in fact there were better ways of doing coalition. What you simply need to do is to, yes, get on and deliver the things on which you agree, but where you can't agree, don't do it through backroom deals and try to use the whips to force it through. That's what Parliament is there for. I'm a great believer, a passionate advocate for the role of Parliament. Let Parliament decide. Don't sort things out through the back door. Allow the whole of the country to become involved in that debate. What we've actually seen in the coalition, where the disagreements have been played out, actually it's engaged a wider public, and I think we need to enable that to happen. So I think going forward, I hope that whatever the outcome, and no one party is going to end up in overall, if you like, charge, I think it will be a great opportunity for us all to engage in the political discourse going forward.
So you will go into opposition if there's another Lib Dems
It's not going to
coalition?
happen, I've just told you, it's just not going to happen.
Andrew, thank you. This is a question from Simon Elliott for Graham, and it is in relation to your manifesto, which I'm conscious of the fact you said you hadn't yet had a chance to read because of work. It was only in fairness launched today. Thank you. Yeah, you. Elderly man, grey hair. The question from Simon asks, as the UKIP manifesto wants to remove the EU Working Time Directive from junior doctors, but the BMA say doctors can opt out, and the limit is for safety, is this a pointless manifesto point?
Well, I think it's accepted that it's been a disaster for training doctors particularly. They don't get the necessary experience and the hours that they need to do. And I was unaware the BMA were against it. I thought they thought it was a bad thing and it should indeed go. Certainly we think it's an interference which shouldn't be there and should go away.
Thank you. This question is addressed to the Conservative candidate. Actually, no, it's not. It's a statement, but you have a chance to reply as it makes observations in relation to the way the Conservatives have managed certain things. This is from Peter M. Lemaire. As the coalition has not seemed to moderate to any great degree the vicious Tory government, particularly on pursuing the further privatisation and profit motive in the NHS and social services, will all the candidates oppose joining a coalition with the Conservatives? Andrew, I think you've answered this. So if we start with Tim and work our way across, and then Derek, I'll give you the right to reply to that statement.
Well, the Green Party has been very clear that we won't go into coalition with the Conservatives. Actually, go further than that, we won't even have some sort of confidence and supply arrangement where we support them as a minority, because that might also be an option. And I think that's the challenge for all the candidates as well. If they really do consider the Conservatives to be so bad for the NHS, they've got to be very clear on this.
I don't really accept the premise of the question because, as I said before, Labour started privatisation and it's 4 or 5% when they were there. It's gone up 1%, so it's hardly increased. The PFI problem is the one we're concerned about, and so there shouldn't be any more PFI. It should have stopped long since. But we've said that we're not going to go into any coalition with the Conservatives.
Thank you. Andrew, you've answered the question. You happy you've answered the question? Okay.
Yes.
All it is?
Yes. I mean, this is quite an easy...
Go on, admit you're going to...
Well, I'm... For the good of the country. I've spent a lot of time in the last few years in this constituency campaigning on health issues. I've met and become friends with many of the health staff that work in our hospitals. I think they kind of assume that I'm opposed to the Tory party, and my circle of friends and acquaintances would narrow considerably if I had anything to do with the Conservative Party in government. I think one refreshing thing about this election is that there is a clear gap between the parties. You really have got a choice this election. It's not murky and nuanced. You've got a clear choice, as has Andrew.
Was that a no?
I think the audience know what I was going to... I get the impression that you were going to say.
I'm aware that we probably have a minute limit, so I won't list all of the reasons why I would not go into coalition with the Conservatives. But yeah, can I just say, hell no, I would not in any way go in with the Tories.
Okay, thank you.
My turn?
Derek, you have the right to reply.
Okay, well, I'm stunned because I sat through lots of Hustings 5 years ago, and Mr. George went on and on about the balance of power, and he went on and on about we're not going to get majority, we will work with the Tories. And you said that you were the one that introduced the word balance of power, simply to stop me winning. Anyway, I'm happy to win if you don't want a coalition with the Lib Dems, so please vote for me.
Do you want him?
But what I'll say is, I don't accept the premise of the question either, because I know an awful lot of Conservative people, and they are decent people, and the word nasty. I mean, if you read every single piece of my literature, you will not find anything negative about someone else in it whatsoever, and that is not true of every single one of these candidates. So you just need to look at the literature and decide for yourself. But if for the good of the country, to get the economy in a good shape and to continue as it is now, and to get the best public services for everybody involved, I'll work with whoever will work with me on that.
Thank you, and Peter, thank you for the question. The final question...
The reply.
Can you...
Would it be possible to make a small comment on the reply?
If you're limited to a minute, then yes, as you've asked, and nobody else
There's
has.
a microphone though, isn't it?
Microphone?
Microphone to...
As long as it's reasonably polite.
I will try to be polite.
unfortunately, Andrew, just first to you, is that Nick Clegg just today has seemed to indicate that he would be prepared to go into a coalition with the, and I sincerely hope that you will make sure that that. I think it was a tragic thing that you did that, because most people here, certainly in West Cornwall, voted for you because we didn't want a Tory government. It was against a Tory government, and what we got was a Tory government which, because you didn't go in as vote to vote, then you didn't have really any influence on it. It has been absolutely vicious, and I'm sorry if that's impolite, but you have been, the Tories have been totally vicious against the most vulnerable people. I mean, I would like to ask from earlier on your comment, and some others have seemed to assume that it's all because of this debt and deficit and the economic crisis. Well, whose crisis? Whose crisis? Whose debt? It was the bankers' debt. Why do I have to pay it?
Thank you. The final question I have here is from Nick Round, and I'll read it out. And this is primarily, I think, for Andrew.
Yes, I'd be glad to comment from other people.
Fine.
I can remember it if you would like it.
Why doesn't that surprise me? You want me to do it? Okay. Your committee members want me to do it, so I'll go for it. The introduction to the original Health and Social Care White Paper, signed by Nick Clegg together with David Cameron and Andrew Lansley, contains the statement: "This white paper is based upon a blend of Conservative and Liberal Democrat principles." Would Andrew George please clarify which Liberal Democrat principles were embodied in the eventual bill, which it's noted he opposed, and how he thinks they got on in practice? Yes, they got on in practice. If I give Andrew the opportunity to answer that first, and then if any other candidate wants to make a brief contribution, that'll be fine.
In the original coalition agreement, the proposal for the grafting into primary care trusts, as they were then, of some democratically elected representatives and the representatives from local authorities, with in fact the clinicians themselves, primarily GPs, making up a minority of the representatives, was something which clearly the Liberal Democrats were very keen to achieve. The Lansley proposals was a complete rewriting and trashing of the coalition agreement. I mean, where we are at the moment is that, of course, as you know, my position is that anything which actually threatens within that act, which threatens the NHS as a result of the marketisation of the NHS, is something which clearly needs to be repealed with the least possible disruption. And in fact, I mean, the party in its manifesto today has said that we will repeal those parts of the Health and Social Care Act which in fact make the NHS vulnerable to any further privatisation. We will bring to an end the role of the Competition and Market Authority. So, I mean, the fact is that yes, it was clearly a coalition of a large majority party with a small minority party, and therefore it was quite clear that that small minority party wasn't going to, you know, in the end, write the bulk of the Health and Social Care Act. What I had said, and I said earlier, and I'll say again, is the fact that we should have used the coalition agreement as the template, and then if it varied from it, then Liberal Democrats should have actually used that as a freedom to vote against it. That's what I did. That's what I'd do again if we were in a similar situation, which I have no intention of being, but if we were in any situation, if we were in coalition with Labour or with the Greens or with anyone else, that in fact that is, I think, the template which we should use, that we shouldn't simply change what we have committed ourselves to as a result of changes which have been changes not agreed across the two parties in the coalition agreement.
So when Nick Clegg made that statement about their principles, it was not like uniquely for him. The economic...
Yeah. The does anybody else want to contribute briefly? Moving, I think we move from Derek onwards, if anybody wants to go, starting with that.
Well, only that it's already been stated how many Lib Dems supported it, so if it was so terrible at the end, why did they support it?
Rob?
I kind of agree with what he said, actually.
Dennis, I'm guessing you are likely to agree as well, yeah?
I wanted to make an observation about Nick Clegg. Now, I do happen to believe that Andrew is a genuine friend of the National Health Service. I don't doubt that at all, and he demonstrated that by campaigning against the Health and Social Care Act. I don't have a problem with saying that. I do not think that applies to Nick Clegg, because he was making apparent some years before the general election that he favoured an insurance-based system on a European model.
No, he didn't.
And so he's said that in the Observer newspaper. I've actually cut it out.
I'll
bring it along.
please.
He said that in the Observer newspaper shortly after he was elected leader. He preferred an insurance-based system on a European model. Now, every party has a left and right. Nick Clegg and the leadership of the Lib Dems are on the right. They are happier where they are at the moment than they would be sitting in a cabinet with Andy Burnham and Ed Miliband. And that's what I am worried will happen again after the next general election, that it's going to be a rerun. Now, I think there was possibly a fact that because people were disillusioned with the last Labour government, which had been in power with a long time, they projected their hopes onto the Lib Dems in a way that was, saw them as a more progressive party than they actually were. And I speak in no spirit of hostility to Andrew's behaviour about the National Health Service.
Thank you. Graham?
Well, you've just got to be very careful that you're not misled again. There's a lot of hypocrisy about some of these things. We mentioned tuition fees and the harm that's done to the Liberal Democrats. But Labour aren't without fault on that either. They promised in Blair's time they wouldn't have tuition fees and then did so. They promised they wouldn't increase them and then did so. The Tories said they had no plans to increase VAT. No plans to increase is code you have to be aware of. And our problem as a small party is getting people to believe that if you vote for us, we can be elected. Just remember the European elections. We got 36% of the vote. Tories only got 26%, and the others were about 11 or 12. So it can be done. And you're not wasting a vote. If you vote for us, we've not been in power, we've not broken promises, we want to keep promises, and we want to give people the right to recall MPs without the MP having to agree, so you can vote us out.
Thank you. Tim?
Yeah, I think just in terms of Liberal Democrat principles, which is what the question was about, I think it's possible to just sort of track the political philosophy of the Liberal Democrats back to the Liberal Party and the kind of John Stuart Mill, laissez-faire, market-based ideas around political economics of the 19th century. There's a clear tradition of thought that feeds into the party in the present day. And I go along with Cornelius, really, that what we discovered after the last election was that the Liberal Democrats we thought they were a left-of-centre party, but in fact they turned out to be a right-of-centre party, with most of the leadership quite comfortable with this more market-based approach that they've introduced into the NHS and other areas as well.
Yeah. Tim, thank you. I just have one final quick question, bearing in mind the time, and this is for Graham, and it's from Dr. Lynn Jones. And it's fairly straightforward. Do you regard homosexuality as a disorder that can be cured? ? And the background to that is this is apparently the view of one of the UKIP candidates who is due to speak at a conversion conference. So I guess the simple answer would be yes or no.
No.
Thank you. Thank you. Okay, that concludes, unless I'm under any misapprehension proceedings. Can I ask you, in the usual way, to thank the 6 candidates, please, for their... Okay, I've had a last minute request from the Health Watch Committee. If you would like to give a little donation to the cost of hiring the particular facility, then there'll be a collection bucket at the back. Is that right? Okay, thank you. And thank you very much for coming out, ladies and gentlemen. Thank you.